This section continues with the symptoms and medical conditions related to the female reproductive system. So cervical dysplasia is the development of abnormal cells in the lining of the cervix. Dysmenorrhea is difficult or painful menstruation. Dyspareunia is the condition of experiencing pain during sexual intercourse. Endometriosis is the presence of endometrial tissue somewhere other than in the lining of the uterus. Here's a picture of cervical endometriosis. Menopause is the permanent cessation of menses. Menorrhagia is an irregular or excessive bleeding during menstruation. Metrorrhagia is the irregular bleeding from the uterus between menstrual periods. Myoma or uterine fibroid, fibromyoma, are benign growths that develops from the smooth muscular tissue of the uterus. It's all those several words for the same type of condition. Here's a picture of some myomas. Pelvic inflammatory disease, or PID, is the inflammation of the female pelvic organs caused by infection by any of several microorganisms, such as gonococci and chlamydia. Polycystic ovarian syndrome, sometimes that's POS as well, is the hormone secretion disorder in women, and it's characterized by irregular menstrual periods, excess hair growth, obesity, and numerous other symptoms. Here's a picture of the polycystic ovarian syndrome, or ovary syndrome, a normal ovary on the left, and then on the right you can see all those small cysts in the ovary of the polycystic ovary. Sexually transmitted diseases, STDs, or more often now it's referred as STIs, but the book has STDs, are communicable diseases spread from one person to another, primarily through sexual contact. The uterine is the protrusion of the uterus into or through the vagina. The vulvodynia is a chronic vulvular discomfort with complaints of burning and superficial irritation. Abortion, abbreviated AB, or spontaneous abortion, abbreviated as SAB, is the expulsion of an embryo or fetus from the uterus before viability. An incomplete abortion is an abortion without expulsion of all of the products of conception. Abruptio placentia is a premature detachment of a normally situated placenta. Braxton Hicks contractions, or false labor, are the painless uterine contractions that happen throughout pregnancy. Breech pregnancy is the pregnancy in which the buttocks of the baby is present at the bottom of the uterus while the head remains in the upper part of the uterus. Dystocia is a difficult childbirth. Here's a picture of that breech pregnancy where the buttocks are where the head should be. Additional terms related to obstetrics are eclampsia, which are seizures or coma in a patient with pregnancy-induced hypertension. Ectopic pregnancy is a pregnancy that occurs when the egg implants itself outside the uterus. Gestational diabetes is diabetes that develops or first occurs during pregnancy. Infertility is the inability of a couple to conceive regardless of the cause. Nuchal cord is the loops of umbilical cord around the neck of the fetus, posing risk of intrauterine hypoxia, fetal distress, or death. Oligohydramniosis is the presence of an insufficient amount of amniotic fluid. Placenta previa is the condition in which the placenta is implanted in the lower segment of the uterus instead of the upper part. Here you can see a nuchal cord condition. Here, this is placenta previa, which causes the vaginal bleeding and can be a very serious condition. Postpartum depression is a form of clinical depression that occurs soon after giving birth. Preeclampsia is the development of hypertension with proteinuria, edema, or both due to pregnancy. A prolapse cord is the slipping of the umbilical cord into the vagina before delivery. The rupture of membranes is the spontaneous rupture of the amniotic sac with release of fluid preceding childbirth. Toxoplasmosis is an infection caused by protozoan parasites transmitted to humans from the droppings of infected cats. This is why they tell women not to change litter boxes due to toxoplasmosis. And if it's contracted by a pregnant woman, it can affect the fetus in many ways, including profound physical abnormalities. Atresia is the congenital absence of a normal opening, such as the esophagus or anus. I'm sorry, we've moved on to terms related to neonatology. And ASD is the atrial septal defect. ASD is the failure of an opening or foramen to close between the atria after birth. A cleft lip is a congenital facial defect of the lip. A cleft palate is the congenital fissure in the median line of the palate, often associated with a cleft lip. Here is a picture of a cleft lip, and you may have seen this before. Down syndrome is the congenital chromosomal condition characterized by mental retardation, retarded growth, and various other physical abnormalities. Gastroschisis is a congenital defect in the anterior abdominal wall of a newborn, usually accompanied by protrusion of the intestines. Jaundice of a newborn is the inability of the infant's liver to metabolize bilirubin. And here you can see the physical characteristics due to Down syndrome. Neonatology continued. Some conditions that you might see is microcephaly, and that's the congenital condition characterized by an abnormally small head, and it's usually associated with mental retardation. An omphalocele is congenital herniation of the umbilical cord. Patent ductus arteriosus, PDA, patent ductus arteriosus, is the failure of a fetal circulatory vessel to close after birth. Sometimes it's a patent ductus arteriosus, PDA, patent or patent. Spina bifida is the congenital condition in which the vertebral column does not close properly, and it's usually accompanied by protrusion of the spinal cord and or meninges. Tetralogia Fallot is a set of 4 congenital heart defects of the ventricular septal defect, the pulmonic valve stenosis, malposition of the aorta, and right ventricular hypertrophy. And here you can see the types of spina bifida. Spina bifida occulta in A was where the vertebrae are completely fused and no external sac is present. Meningocele is B, that's where the external sac contains meninges and cerebrospinal fluid, and myelomeningocele is C, where the external sac contains meninges, cerebrospinal fluid, peripheral nerves, and the spinal cord tissue. Turner syndrome is the congenital abnormality of the X chromosome that alters the development of females. VSD, or ventricular septal defect, is the failure of an opening or foramen to close between the ventricles after birth. Some common tests and procedures you're going to see in this system is the Group B Streptococcus, and that's the test for a bacterium that, if transmitted from the mother to the fetus, can cause life-threatening infections in newborns. Pap test, or Papinoculo, I always have a hard time saying that one. Papanicolo, we may have to look that one up. Microscopic examination of the cells collected from the vagina and cervix to detect abnormal changes, such as cancers. Papaniculau is how you say it. Sorry about Papaniculau. Pregnancy test is a blood test to determine the presence of the hormone human chorionic gonadotropin, or HCG, and that's secreted by the fertilized ovum. A quad marker screen is the blood test to determine the risk of having a baby with a birth defect. The torch panel, that's a group of tests to screen for antibodies for organisms. That's toxoplasmosis, rubella, the cytomegalovirus infection, and the herpes simplex. And those that can be transmitted from mother to fetus can cause congenital infections. So here's a picture of the torch panel, and you can see why it's called that: for T for toxoplasmosis, R for rubella, C for the cytomegalovirus, and H for the herpes simplex virus. Some common diagnostic procedures are the amniocentesis, and that's the transabdominal aspiration of fluid from the amniotic sac to test for certain problems in the fetus. The APGAR score is numeric results. It's a numerical result of a test conducted on an infant right after delivery, and it evaluates a newborn's physical condition quickly. CSV is the chorionic villus sampling, and that's the removal of a small piece of placenta tissue from the uterus during early pregnancy to test for fetal abnormalities. Here you can see a picture of an amniocentesis where they're sticking the needle into the amniotic sac to remove that fluid for testing. Colposcope is a thin lighted endoscope inserted into the vagina to allow for direct visualization of the vagina and cervix. Colposcopy is a visual examination of the tissues of the cervix and the vagina. The fetal ultrasound, or an obstetric ultrasound, is the ultrasound done during pregnancy that uses reflected sound waves to produce a picture of the fetus and the placenta that nourishes it and the amniotic fluid that surrounds it. The fetoscope is a special type of stethoscope used for listening to a fetus in the womb, and it's usually used after about 18 weeks gestation. And HSG is a hysterosalpingography, hysterosalpingiography, and that's an X-ray examination of the uterus and salpinges after injection of contrast dye. A mammography is the X-ray examination of the breasts, and it's used to detect breast tumors. Pelvic ultrasound is the ultrasound of the pelvic area, and a transvaginal ultrasound is an ultrasound using a transducer inserted into the vagina to view the internal female reproductive organs. And here you can see an ultrasound, a transvaginal one, and a pelvic ultrasound, and you can see the pictures. See the camera on the left and the pictures on the right. Common surgeries and procedures related to the female reproductive system is colporrhaphy, or an anterior-posterior repair. That's the surgical procedure that repairs the defect in the wall of the vagina. A cryosurgery is a gynecological procedure that uses liquid nitrogen to freeze a section of the cervix to destroy abnormal or precancerous cervical cells. And a D&C is a dilatation and curettage, and that's the surgical procedure in which the cervix is dilated and the endometrial lining of the uterus is scraped with a curette. And we'll stop here and move to the next section.